Welcome then to this session on CINAHL. We'll look at basic searching on the native EBSCOhost interface. So I'm Richard Crooks. I'm a Senior Manager for Training Services covering the UK and Ireland for the medical sector and also a Chartered Librarian. So this 45-minute webinar will introduce you to the basic searching concepts on the EBSCOhost interface for CINAHL, which is the most widely used and respected research tool for nurses, students and allied health professionals. In this particular session, we'll look at keyword or free text searching, refining results, viewing, and saving results and searches. So just as a reminder, in terms of the way we run these sessions, you are muted for the time being. However, if you do have a comment or question to make during the course of the session, please use the chat panel, which you should see on the right side of your screen, the white space at the bottom there. Send them through to me and I'll respond to you as quickly as possible. Failing that, I'll get back to you after the session has concluded at some point. If you cannot see that WebEx panel currently, then check the top of the screen. You might see a floating toolbar, so you can enable chat there. I have muted everyone just to avoid any background noise or interference, but as a reminder, if you have any intermittent audio issues, I'd recommend going to the audio link on the top toolbar and follow the link to audio conference. You can also check your speaker and microphone through the test link as well. Okay. So by the end of the session, you'll be able to access CINAHL and EBSCOhost. So for those of you who work in NHS in England, I'll take you through the steps there. Obviously, if you're in other parts of the UK, friends, or in the HSC in Ireland, access will be slightly different. You may have a dedicated link on the library site internet page to get to CINAHL, but this session has been set up originally for those working within NHS in England. So we'll look at how to access in a moment accordingly. You'll be able to perform a basic search to find articles of interest, so using keywords or free text. You'll be able to refine your search results using the available limiters or filters. And then also you'll be able to save articles and searches for future access. We do have a companion advanced session which explores some of the more detailed features as well. So we'll also conclude with a look at finding further help and support information on CINAHL databases. Okay. So in terms of access, in a moment we'll go to the NICE website. But just a reminder for those who are library staff within England, working for the NHS, you currently have access through the core content deal, the CINAHL database, which is a basic abstract and index-only database, which gives you a quantity of 70 full-text journals. If you have other subscriptions, for example, if you work in NHS, in other parts of the UK, you may have CINAHL Plus a full text, or you may have CINAHL Complete, either as a local or regional subscription. Okay. However, I hasten to add the searching that we're doing today will be applicable across the board. In other words, it'll be applicable to any version of CINAHL that you currently use. Okay. So we'll look at CINAHL specifically in a moment. Just a reminder though, access is through the NICE website for those who are based in England. So you can log into Open Athens via nice.org.uk. So I'll take you through the steps now to do that before we look at the live demo of searching. So make sure I'm on the right page here. So I'm going to switch here. So in a moment you should see the NICE website. Okay. And on here, you'll see there's a link to the journals and databases. So click on that link there. That will take you to the following page. And if you scroll below, you'll see we've got this option to log into Open Athens. So click on that link there. And then you'll log in with your Open Athens account. Now, if you don't have one, obviously you can register here for one. Or if you forgot your password, you can follow the prompt there. Otherwise, click Login. This will then take you to the next page with your resources. So it will show you what you've got access to as an NHS employee via Athens. And of course, in this context, we'll go to the EBSCOhost databases. And that will then take you to what we call our Choose Databases page. So on this page, this will allow you to select individual or multiple databases to run your search. So to begin, I just want to highlight, I mean, we often get questions about this, the matter of cross-searching. So say, for example, you want to run the same search on CINAHL and also on Medline, the biomedical database. So you can see we've got CINAHL Medline available. There is information on the database, Okay, if you want more detailed information, click on the more information link here, and this is the database help for CINAHL, and on here I'll give you again more information about CINAHL, the nursing and allied health database. And by the way, you'll find information on health sciences librarianship also included in CINAHL, as well as nursing, biomedicine, alternative complementary medicine, etc. There are search tips provided, details of searching. There are also searchable fields. Also to point out here, an unqualified search. So what we'll do in a moment, we'll run an unqualified search, which basically means we'll enter keywords or free text and run the search. When you do that on EBSCOhost, on the database, you'll see for CINAHL, the default fields consist of the following: title, abstract, and subject headings. So what that means is when you enter your search terms, the results will be retrieved based on your term or terms appearing in any of these fields. It could be one of these fields, two of these fields, or all three fields. Not necessarily all three, but if the word appears in the title, for example, but not in the abstract and subject headings, it would still be retrieved. Okay, so again, this is what it's searching behind the scenes. So that's the database help there. We also have a list of titles, index titles for the database. So if you're looking for a particular publication, you can browse or search for this through this list. This is also available on the top toolbar on the top left there as well. Now, in terms of searching, if we go back to this page, if you wanted to run a search on both CINAHL and Medline, you would select both databases here and click Continue. You will then see Show All to indicate we're searching across both databases, and you can enter our terms here. So, for example, if we wanted to run a search on influenza vaccine, we could just enter our keywords. And by the way, for this particular setup, you'll see the search mode, the default mode is Boolean phrase. So what this means is you're searching this as a phrase. Okay, influenza vaccine, and the words in that order. So it's searching for a phrase. Okay, and then we're searching across both CINAHL and Medline. So I click search here. And again, if you've got any questions or comments about this, please send them through on the chat panel. And then this brings up the results here. Now, we are going to run another search in a moment, but I just want to scroll down to the bottom of the page because you'll see here we've got both databases indicated, so you can focus on results from a particular database, but otherwise they're collated here in this result list. Okay. So I'm just going to stop here momentarily because I want to just share something with you on the PowerPoint in terms of cross-searching. So one thing to note here is that when you do run across searches, and just to reiterate, of course, the default fields for searching for CINAHL are title, abstract, and subject headings. If you're searching Medline, it will also search through those additional fields automatically as well. We have these three options as well, by the way. So when you run a search, a keyword or free text search, it's also you can also use these expanders to expand the results in the results list. So the first two are off, so you don't see those. They are there, but they can be selected individually. So apply rated returns will take your search and look for synonyms from within the subject index. We get more into the subject index searching in the advanced session, but basically you have a list of terms which identify the content of an article. These are the index terms, and if there is a synonym matching your keyword search, that will bring back results as well. Likewise, the plurals of terms. So an example will be, for example, with child, it would pick up children, childhood, etc. Also, search within the full text of articles means it searches for your keywords within the full text of an article. So if you see a PDF link, an HTML link to full text, your search is also going to be searched within the full text, not just in the initial default fields. Then the third one is the apply equivalent subjects, which we'll come to again in a moment. So just to reiterate or clarify what this means, and this is on by default, by the way. So for those who work in NHS in England, when you run a search, a keyword search, it's also going to make use of apply equivalent subjects. So what does that do? Basically, it expands your search to include exact terms for that concept in the map vocabulary. So vocabulary is just a subject index. So in this example, if you ran a search, a keyword search on workplace injury, it would then map your term to work-related injuries, which is the index or subject term for this. That in turn will then follow the other index terms, such as occupational injuries, occupation-related injuries, and work-related injuries. So the bottom line is expanding your search to bring back relevant content. So not only where your words appear in the citation, or in the title, or the abstract, or in the subject headings directly, but also to include related terms from the subject index. So in other words, it's bringing back results which have been indexed with these terms. Okay. So please do send through any questions or comments that you have about this, but this feature is switched on by default. And the final thing before we get onto another search here, when cross-searching, any duplicate results are removed, okay, based on the matching citation. So if the title, so for example, if you have the same article indexed in CINAHL and also Medline, you will end up with just the one record, because if the title, author field, date published, and the serial number, the ISSN of the journal, or the journal name, or the book number, the ISBN, if they match, then you will end up with just one record. So there is an automatic deduplication in process when you search multiple databases on the EBSCOhost interface. Okay, and there's a link there to the document to verify that. Okay, so that's just a bit of the background in terms of the way that you're searching, etc. But we will now go back to the live demo. So this time, though, we're going to be looking at searching CINAHL individually. Okay, so we're going to switch to the live demo now. Okay. Okay, so I'll just share my desktop once more. And you'll see the advanced search page we're on. So this is the default search page. Again, you can see Boolean phrase searching. This is the default search, searching for phrases. And then you have the apply equivalent subjects feature on as well by default. So we'll look at something which is very topical, of course, so COVID-19. And you'll notice also as I type, there's this autocomplete feature. So autocomplete basically is like predictive text for a mobile phone. It basically prompts you to choose terms that you may be wanting to search on. So these are based on other users and popular searches. So if you like, you can use this one down, and instead of typing this all out, you can put or between them to combine. So you can search for a variety of terms together in the one search box. Or you could simply just enter, you could do this, for example, let's see, or this, okay, if you prefer. Okay, so I could do it this way, if I didn't put coronavirus here. So we can add another row here, by the way. So you can also search in this way, use or like this, if you prefer. Okay, so you can search in this way. So if we leave that as it is now, okay, we can still search on all those terms together using or. So in other words, anything where COVID-19 appears, or 2019 nCoV, or SARS-CoV-2, or coronavirus. Anywhere these terms appear in the title, the abstract, or the subject fields of an indexed article or item in CINAHL. And we're using or because it could be any of these. And then we click search. These then bring back results. As you see there, we've got a search query again there. We've got the results displayed. And of course, the next step will then be to narrow it down or filter our results to a more manageable level. So the first thing I want to illustrate is the use of full text. We have the link full text option. So link full text means it's going to bring back any articles in those 70 full text journals that are indexed in CINAHL, plus any other online subscriptions that the NHS subscribes to. Remember, this is national and or even locally. Okay, so it's going to bring back multiple links here. Also, if you subscribe to other EBSCOhost databases, for example, Medline with full text, it will also pull in the links from Medline in addition to those in CINAHL, because it's sharing the same EBSCOhost platform or interface. So that's the full text being picked up. You have references available, so if you want to retrieve articles with cited references, you can. If you are not going just for full text content, you can select abstract available to retrieve items which have an abstract or summary available. As you scroll down, you can see we've got the publication date. This is the date slider. And you can see here the default entry date is 1992 for this particular condition, etc. So we can go to the 2021, of course, but you can drag this across and make this more current, say, for example, from 2019. Okay, that will narrow down our results. And then we've got other options. So if you're looking at a particular source type, for example, you want to retrieve items in an academic journal as opposed to a magazine, you can choose academic journals here. And then also, to make our search more relevant, we can then use the subject headings. So you'll notice here we've got this filter, this limiter subject major heading. Click on the arrow and you'll see the list of terms. So what this does is highlight the key subject terms provided by CINAHL, the CINAHL subject headings, to identify the relevance of the content. In other words, what is the article or book chapter or dissertation actually about? Okay, so they're listed in hit count, so not surprisingly, the majority of references in this list are indexed with COVID-19, followed by coronavirus infections, then viral pneumonia, etc. Now, in selecting these options, these filters, you can only choose one item at a time. If you want to select more than one, click Show More, and then you can select from this list here. To make it easier, if you want to sort them alphabetically first, click Name, and then you can choose the other relevant options as well. Once you've done that, you can click Update. So now we're retrieving records based on those subject headings, and they are the major headings. So what does that mean? That means they are the primary focus for any item indexed with that term. Okay, so for example, now you can see here we've got COVID-19 pandemic is an index term for this particular article, and this is the major focus of that article. Likewise, these ones as well. Each time you apply a limiter or filter, by the way, they're collated in this box here. We call that the bread box. If you think of the breadcrumb trail following or tracking back to how you searched, this is the bread box. This collects that information. And you can remove any item from here. So for example, if you want to remove one of these headings, you could. Or if you want to focus on other source types, other than academic journals, you could just click the cross here and it would refresh the results list. Scroll down, you'll see further options. If you're looking for an item about COVID-19 from the academic journal literature within a particular publication, you can click this arrow and see the index publications. If you want to home in on one of those, you could just select one or go to Show More, and then you can select individual ones here. Or you can select Name and sort them alphabetically, and then choose which ones would be most appropriate for your search. Also, it's quite useful to know if you're advising users that are looking to publish research on a particular topic, when you check the publications filter, it will give you an indication as to the most popular titles for that specific topic. Then you have publisher as well. So if you're looking to retrieve items from the same publisher, such as Mark Allen, you can. Language, so you can filter to English only here. And then finally, we also have age and gender. So in this context, if you're looking at a specific age group, for example, COVID-19 in relation to the younger people, then you can choose it here. For example, if you look at adolescents only, then you can choose this filter here. So age here is again another option that relates to the indexing for articles. So you can see here we've got adolescent 13 to 18 years. This is a subject field, so this is part of the subject indexing, which you can also access by going to the top of the screen and clicking CINAHL subject headings. Okay, we'll come to that in the advanced session, which you may have signed up for. And then finally, you have gender as well. So if you want to focus on a particular gender, so for example, male, then you can choose this option. Okay. Now, the last option you see there, and again, you may not use all these options. It depends on the nature of the search you're running or how you're advising your users. You'll see, if we scroll down, we've got geography. So geography here relates to country of publication. So if I just select UK and Ireland here, we're now going to retrieve results on COVID-19 in relation to adolescents, but where these items are published in a UK or Irish journal. So it could be the British Journal of Nursing, or it could be the World of Irish Nursing and Midwifery. Now, before we look at those results, I also want to highlight, you can hide the search history, by the way, by clicking search history here, and that will collapse that information and hide it in the background for you. So we've got our results displayed there. By default, the results are displayed in reverse in the most recent first. So if you're looking for the latest article, that's fine. However, if you want to look at the most relevant, then click Date Newest and choose Relevance from here. Okay, in some cases, the most recent one is the most relevant as well. Now, you'll notice here, especially from the first one, although we chose UK and Irish journals, so this is appearing in the in this particular title here. So if I click on this article here, this is the International Journal for Equity in Health. So this is a UK journal publication, but it's actually research carried out in Brazil, okay, in the Brazilian Amazon. So it just highlights the point that although you may choose UK and Ireland as a journal subset, it's not going to necessarily guarantee that you'll find information related to a UK Ireland population, okay? So bear that in mind. We'll look at another item here, okay? We'll find something which is, so again, some of these are from within China, etc. Africa, China again, okay. So again, some of these are not obviously from the UK specifically, okay. So we just choose one of these now. But you can, again, go to the publication and choose from this list here. For example, we can choose, let's go to BMC infectious diseases and choose one of these, okay? So again, a lot of these are related to China specifically, okay? So we just choose this item here, okay? Again, this is Qatar this time. And you can see we've got on the left, we've got the links to the full text, we've got the links to the authors, links to the journal, and then links to the subject headings or subject fields as well. On the right, we've got the tools. We can use Google Drive to save this reference. We can otherwise use Add to Folder, which is the EBSCOhost folder, which you can access from the top toolbar. There's the print option. So if you're looking to print a reference from this particular record, just click Print, and then you can follow the prompts there. In addition to printing, you can also choose the citation format you want to have this record available in. So for example, Harvard, we'll click Print there. So any questions or comments, please let me know. Obviously, with your print, you can also save it as a PDF here as well, if you need to. You then have the option to email this as well. So click on the email option. This will include the full text as available and PDF as a separate attachment. Okay, so you can send that directly through this email manager as well. You have the save option, which generally works best with Internet Explorer, for those used to use Internet Explorer, or IE. So that will give you the option to save this. Now, if you're using Chrome or Firefox or another browser, then you may want to just click Save, and then you can highlight this, select all, and copy into Word, or you can right-click and print again, etc. There's the site link. So if you want to know how to cite this particular reference, choose Cite, and then you can choose the appropriate reference style, such as Harvard. If you want more detailed information about Harvard referencing, click Harvard here, and then you can choose and select and look at the examples there, various patterns there, in terms of how to reference with Harvard. The export option we cover in the advanced session, so we'll leave that for now. You can create a note here, you can add a note to this record that you could store in your folder. Okay, so you can add some text there, and that will be associated with this particular article. Now, if you're looking to, rather than email this reference, if you are looking to actually send a link to it, there is a temptation, of course, to use the browser URL. So we don't recommend using this. What we do recommend is using the permalink. So permalink is the link that you can use. This is what we call a persistent link, and it will link you directly to this page. Now, if you are sending it to a colleague in the NHS, then obviously when they click on it, they will need to authenticate with Open Athens. Obviously, if you work in the academic sector or in other parts of healthcare organizations, then you might have a different authentication method. If you use the IP ranges, for example, if you're an NHS in Scotland, they still have IP ranges, so when you click on it on site, you'll still be linked through to the publication or the article. So that's the option to forward a link to a user, so you can just generate the link, permalink, and cut and paste it into your email address. Sorry. Now, if you look at the full text specifically here, we'll choose some other articles here. Okay. Then, and again, we'll just switch here from looking at this particular journal. So just remove it here. And then we'll look at this item. So we have the HTML PDF here. The HTML just gives you the full text online. Okay, and it also adds 2 additional features. The first one is the translation option. So if you speak more than one language and you want to read this article in your native language, choose the list provided here. If, on the other hand, you prefer to listen to this, if you're partially sighted or have some visual impairment, or you work with users who have some visual impairment, then you can inform them of this feature, this text-to-speech software. So you can listen to the article. By default, it's a British accent. You can change it to American or Australian, and you can also change the settings here. So the words highlighting, the sentence highlighting, and also the speed. So for each HTML full text article indexed in CINAHL, you will have access to that feature. And you can also download the MP3. So if you don't have time to listen online, you want to come out of the session, you can also download the MP3 and listen to it offline. So they're the 2 features associated with the HTML. On the other hand, you may want to just look at the PDF or download the PDF. So you'll see we've got the PDF link here. That'll open up the reader window. So obviously, again, you can read this online, but you've also got the option to download the PDF or directly from the reader toolbar or print from here as well. If you want to save this item, then you've got the add to folder icon here. You can also email it directly from this page. And there's also the cite option to, again, inform you as to how to cite this particular article here. The permalink this time, if you want to, instead of sending this as an attached file, as an email, which you can, of course, here, then you can generate the link to it. The permalink, again, is the option to use for linking to this particular publication. So you can cut and paste this into an email, etc. Okay, or if you are creating a reading list or current awareness service, you want to link to this article, then you can put the link here, and any user would then have to obviously authenticate in the normal way to access this content. So that's the PDF record of this article. And just in case you're wondering why you would see some items with HTML PDF, some with only PDF, it's really down to what publisher and permissions we have, whether we have both formats or one or the other. Okay. Now, again, I'm just going to check if there's any questions from anyone at the moment. So I don't see any questions right now. So please do send through any that you may have as we go through this. We've got another 15 minutes or so before we finish. So the next step, of course, besides looking at the display, etc., you may want to even save items from the list. So at the moment, you see the first one has been saved previously because we saved it when we were looking at the PDF. You can then go through the list and select each record individually. From this list also, by the way, you can view the abstract by hovering over the magnifying glass, and you can see the abstract displayed here where appropriate. If you're okay. Now, if you are looking to save a page of records, you can do so. Just go to the share option here, and you can save up to 50 records per page. So click on that link here, and then we can go to our folder, or from the top toolbar, and you'll see here we now have these 50 records displayed. Notice also the full text links are still available, as is the ability to link to the bibliographic record or detailed record page. These are all there. Some of these items, of course, also include images as well. If you click on that image, it gives you this preview and expands, etc. So basically, these images, which could be illustrations, could be maps, could be clinical photos, etc., will just allow you to explore images within the actual article ahead of time. Okay. On this page within the folder, you can still print a list of results. So you've got the print option here. You can email these references. So if you're performing a search for a user, or they just simply want several articles that you found, you could just forward them to this using this form here. You can replace the email form address, by the way, so if you're concerned that this might be blocked by a spam filter, then you can add your own library address there, etc., whichever you prefer. You can send this to multiple individuals using a semicolon. You can remove the items from a folder after emailing if you wish. And then notice also the other options. So by default, you can include the HTML full text, the PDF as a separate attachment if needed, and then you can, but I would untick this because you would end up with multiple emails if you have a number of PDFs. Then you have the current search history and also the citation format to choose from. And then you would send those references. So that's the email manager used from within the folder. Again, at the moment, we use the folder to just store information before we process it. However, there is the option to also sign in. So you've got the Save As File option again, and that's really relevant to Internet Explorer, okay? And again, you can include the HTML, the links, current history, and so on. So if, for example, you wanted to save this beyond the session, maybe you're continuing the search, again, you're advising a user that they need to sign in to store items beyond the session, then what you can do is click Sign into my EBSCOhost, and then here you can create an account. So this is your personal folder. So at the moment, we've just been using the standard folder to store items that we can then process. However, if we want to process this later beyond the session, tomorrow, next week, etc., we need to create a My EBSCOhost personal folder account. This allows you to obviously choose the options, enter your details there, and also you'll set your password. You need to agree to the consent form. If you're concerned or if you get questions about this, what data are we collecting as a company, then you'll see the personal data collection and usage information below. Once you've created your username and password, you can then sign in with it, go to the sign in option and enter them here. I will sign in with Google just for convenience here for me and to speed up the process. So once you've signed in with your username and password, you will then be brought back into the folder, and you'll see it's now my folder, it's Richard's folder, and I have the My icon there for My EBSCOhost. So My EBSCOhost is simply your personal folder where you can store information that's relevant to you. So we have the results there now. Obviously, I've added 50 extra records, so I've got 105 records. These are from the previous search that I ran. And again, I can use this to print, email, save, etc., and export. What this also means is if I go back to my results list, I can then save a search. Not only can I save articles beyond this session, I can save my search. So go to your search history to do this. Again, any questions on any of these features, any experience you had you want to share with others, please do send them on the chat. Okay, so we have the search history below. And by default, this is in reverse chronological order. So you can see here we're on S9 here as the final set of results with all the limits, expanders applied, and then our results below. If you want to resort this search history to see where you started from, go to Search ID and Hash. So this will just resort the search history for you. You can see where we started from, S1 there, S2, S3. Also, this is useful if you want to print this. You've got the print search history option here. So click on that link and you can see the print the history there, and you can right click and print accordingly, etc., or save as a PDF. But if you want to save this online into your personal folder, you can do so by clicking Save Search Alerts. Before you do that, it would also give you the option to choose permanently or temporarily, and also allow you to make edits to the search history. So if you spell a mistake, or if you want to update this, then you can do so. So you can go into one of these, and for example, you could change the date, you can add peer-reviewed, etc. However, if you're satisfied with that, just give it a search name. So okay, by default, CINAHL selected as we're in CINAHL. You can see the search strategy is indicated here, and then we can save here. That confirms the search has been modified, or in other words, it's been saved. We click Continue. it brings up a list of our saved searches. So obviously I've been running numerous searches throughout my time at EBSCO in recent years, and I've been saving some of these. So these are listed by default. They're listed in the order in which they were created. So see, this one's from April 2019, and so date added. So in order to see what we've just saved, we just scroll to the bottom of the page, and you'll see in a moment we have got COVID-19 pandemic. So what that means is, it means we can rerun the search. What we would need to do in this case, we would need to go to our new search, clear our search history first of all, so we can delete it from here now that we stored it. Click new search again, go into the folder on the top right toolbar. Again, you need to sign in for this to access that search. Go to the Save Searches folder on the left, and then scroll to the bottom of the page, or you can sort alphabetically. And retrieve. So whenever you retrieve a search, it's retrieved and run on the database you're viewing at that time. So if I had gone to choose databases and switched over to Medline, when I ran that search, it would run it on Medline, not CINAHL. So although you run it in CINAHL, if you are viewing Medline at that time, you would rerun it on Medline. So now we have our results there. We can just refresh this and rerun them. So we just rerun it on the same database. So basically what this means is, in practice, if you are running a search on CINAHL, you finish it, you save it, you want to come back to it next week, you can rerun manually. We get into about creating search alerts in the advanced session, so we won't cover that today, but you can set up a search alert as well to rerun the search automatically. Then, of course, we have our results displayed accordingly. Okay. So just to reassure you, if this is the first time you've seen CINAHL on the EBSCOhost interface, it's quite a lot to take in, but I will point out a few things here. You've got the option, by the way, to view the interface in your native language if you prefer. So you can choose for any one of these languages, and it will just reword, obviously, the main headings, etc., the search functionality in a preferred language. We have the help option here. So this is the generic help for EBSCOhost for the interface we're using. And you'll see the tutorial there associated with that. You've got the advanced search guided style fields where we run the basic search using our search history. There's information there and associated tutorial. If you scroll down, there's information on the Boolean searching. Okay, and also as we scroll down here, you'll see we've got information about saving, about using the folder here, by the way, and the associated tutorial with the screenshots. Okay, and if you're looking at see, scrolling down, printing, emailing, etc., citing articles, there's information here as well. Okay, and the database help for CINAHL is on the bottom left. Okay, which we saw earlier. One more thing to show you before I take any questions is if we scroll to the bottom of the page, you'll see there's a link to EBSCO Connect. This is our portal for support information on any of our databases, our products. And on the bottom left here, on this first tile, you'll see we've got tutorials. And I'll just show you where you can find CINAHL specific tutorials. If you want to explore that further, go to the bottom left, you'll see, of course, this is the generic tutorials for EBSCOhost. So look at citing articles, my EBSCOhost folder again. There is a link there, and that'll take you to the YouTube tutorial for this particular feature. Okay. Also to note here, you've got the related articles. So again, you've got more information about using the folder. There are the frequently asked questions here on the right as well. Okay. If we go back, you'll see tutorials again, and this time, you scroll down, you'll see we've got CINAHL, the clinical decisions, including CINAHL. So for example, basic searching here. So again, those are freely available. And to add to that, we also have our e-learning path on CINAHL, so which is part of the EBSCO Caveat or Learning Management System. So go to Learning on the top. So if you're new to CINAHL or new to EBSCO's databases, this might be worth your time. There's no cost for this. You just need to register an account for EBSCO Connect to access these courses. But basically, if you go to Browse e-learning paths, you'll see that we have a dedicated e-learning course on CINAHL. So click on that tile there, and then you'll find these are the various courses that you can take. So you can go to whichever one you prefer. If you want to just look at them individually, you can register, of course. Once you have an EBSCO Connect account, click search. And then this is the actual course for this as part of this e-learning path. And you'll see there videos and also quizzes and links to various relevant support information in support of using it. So you can see on the right here, you have the video and you have the objectives in that video as well. Okay. So again, also to add, we do have webinar recordings as well. These are being added to EBSCO Connect, to the EBSCO Academy. So you'll find more and more webinar recordings added here. Okay. So in the future, going forwards, we'll be adding more recordings to this part. We also have our videos as well, so you can view the video collections as you see here, for example, for healthcare. So again, it's our portal for information and using healthcare databases, etc. So feel free to visit that in your own time. So I'm going to stop here and just see if there are any questions or comments. And I think, okay, any comments or questions? I can unmute you as well, by the way, if you do have any. So any comments or questions? Otherwise, we can conclude here.